The unfolding crisis. A nation's health at risk under a secretary's dubious guidance. The recent measles outbreak in Texas, culminating in the first American measles-related death in nearly a decade, has cast a harsh spotlight on the unsettling stance of U.S. Health Secretary Robert F. Kennedy Jr. His actions and pronouncements have ignited a firestorm of criticism from pediatricians, vaccine experts, and lawmakers alike, raising profound concerns about the nation's public health infrastructure and the very future of disease prevention. The crisis began with a muted, arguably negligent, response to the escalating Texas outbreak. Initially, Kennedy misrepresented the death toll in a cabinet meeting, downplaying the severity of the situation by claiming it was not unusual to experience such outbreaks. This statement stands in stark contrast to the reality. The Texas outbreak, accounting for nearly half of the entire 2024 measles cases in the U.S., paints a far more alarming picture. Over 146 individuals have fallen ill, more than 20 have required hospitalization, and a young, unvaccinated child tragically perished. A stark reminder of the devastating consequences of vaccine hesitancy. Instead of advocating for the proven efficacy of measles vaccines, boasting a 97% effectiveness rate in preventing this highly contagious and potentially fatal disease, Kennedy chose a different path. In a Fox News opinion piece, he championed the benefits of good nutrition and vitamin A as a response to the outbreak. While acknowledging the role of good nutrition in overall health, his failure to explicitly endorse vaccination is deeply troubling. The implied prioritization of vitamin A over vaccines is not only dangerous, but dangerously misleading. Dr. Sue Cressley, president of the American Academy of Pediatrics, eloquently articulated the inherent risks in this approach. Relying on vitamin A instead of the vaccine is not only dangerous and ineffective, but it puts children at serious risk. Measles, one of the world's most infectious diseases, can lead to severe complications such as encephalitis, brain swelling, affecting 1 in 1,000 infected individuals, and a mortality rate of 1 to 3 per 1,000 cases. The characteristic symptoms, rash, fever, runny nose, and red, watery eyes, represent only the tip of the iceberg. Kennedy's opinion piece further fueled the controversy by characterizing vaccination as a mere personal choice. This rhetoric, echoing the dangerous misinformation that has plagued public health discourse for years, actively undermines decades of scientific consensus supporting vaccination as a cornerstone of preventive medicine. While studies have shown that vitamin A can be a beneficial supplementary treatment for children already infected with measles, particularly in regions with high malnutrition rates, its efficacy as a primary preventative measure is categorically refuted by overwhelming scientific evidence. The vast majority of this research, it's crucial to note, has been conducted in low- and middle-income countries, highlighting a crucial context often omitted from Kennedy's framing. This deliberate omission adds another layer to the growing concern over his approach to public health. The implications of Kennedy's actions extend far beyond the immediate measles outbreak. His controversial stance has broader ramifications within the context of the current public health landscape. Senator Elizabeth Warren aptly summarized the situation, citing the confluence of challenges, including a severe flu season and the threat of the H5N1 avian flu strain. These are dangerous times for public health. Your irresponsible and reckless efforts to undermine the nation's vaccine policy threaten to fan the flames of disaster. The narrative of this crisis is deeply intertwined with the history of vaccine misinformation. The resurgence of anti-vaccine sentiment can be traced, in part, to the fraudulent 1998 study linking vaccines to autism, perpetrated by former British Dr. Andrew Wakefield. Despite the study's complete debunking and retraction, its impact continues to resonate. Groups like Children's Health Defense, a leading disseminator of anti-vaccine propaganda, have relentlessly perpetuated these falsehoods. And Kennedy's past association with this organization, serving as its head for nearly a decade, adds another troubling layer to the current situation. Kennedy's actions as health secretary have sparked further alarm. His cancellation of influenza expert meetings at the FDA and CDC, the imposition of a stop work order on new vaccine development contracts, and the ongoing reevaluation of a $590 million contract with Moderna for a bird flu vaccine further, indicate a troubling disregard for established scientific expertise and effective public health strategies. The United States is currently grappling with its most severe flu season in 15 years. While avian flu, though not yet a widespread public health threat, poses a significant risk to agriculture and holds the potential to escalate into a pandemic. The combination of these factors, coupled with Kennedy's approach, creates a perfect storm of public health vulnerability. The situation demands a clear, decisive response. The potential consequences of continued inaction, a resurgence of preventable diseases, widespread illness, and potential deaths, are simply too great to ignore. The nation's health hinges on a swift, informed course correction, guided by scientific evidence and a commitment to public health, not political posturing or the promotion of unsubstantiated claims. The health of the American people should not be a subject of personal choice when scientific consensus offers a clear and effective path to protection. The actions of the Health Secretary are not merely a matter of opinion. They are a direct threat to the well-being of the nation and demand immediate and decisive action.